I'm now calling upon Professor Dr. Gunvant Yeola, who is the Secretary of the International Academy of Ayurveda, to come to the podium and speak on present-day food habits in students and its psychosomatic effects. Please, Dr. Yeola.
Jai Gurudev. Good morning. Namaste. Myself, Dr. Gunvant Yeola. I did this particular study for my PhD work. I was thinking about the Achara Rasayan to take my topic for the PhD, but after that I found that the Ahara Rasayana, that is also a good topic for the research. So then I shifted my mind to do the study on this particular topic, which is related to the food habits. When I visited the university canteen, I found that most of the students, they are not following a single rule which is advocated in Ayurveda regarding the food intake. So I choose this topic. So it's my pleasure to elaborate this topic in front of all these learned audience. So the topic is study of present-day food habits in students and its psychosomatic effects with some remedial measures. Present day, the food habits are not in accordance to the Ayurveda principles because Ayurveda has given much emphasis on this particular topic. You might be knowing that in Ayurveda, they have described as a three sthuna, means the three pillars, the main pillars, those are Vata, Pitta and Kapha. And also they describe the Traya Upastambha, that is Ahara, Nidra and Brahmacharya. So this is a one sub-pillar related to the food. So it has made an impact on health in growing age of the students. This particular study was related to the age group of 18 to 24 years. It is clearly mentioned by Charakacharya that a person should eat that much quantity of food which he can easily digest. So here the Agni, this is a core concept of Ayurveda, is important, the digestive capacity in a proper length of time and which will not cause any harm to his body and mind. Present day food habits have changed because of lifestyle has changed very fastly. Life is fast, we don't give a proper time to eat at ease. We are habituated for the fast food, junk food, fried foods. One more reason is related to the workplace. We are working a long distance places, so we carry the tiffins. So we have to take the food material which is we can easy to carry. And most important thing is that the students, they have no tendency to carry homemade food. So the aim and objective of this particular study was to study the effect of present day food habits on Medovaha Srotas, to study changes in dosha, dhatu and mala and manasa bhava due to present day food habits, and to study the rasa, virya and vipaka of homemade, vice versa, the outside food items. The plan of the study was like this: selection of the participants, around 500 participants, the college going students were selected for this study, out of which 307 participants completed the whole study. The written informed consent was taken. Initially, we filled the questionnaire on the first day. No specific advice was given on that day. After 90 days, we collected again the same data. At that time, we give some dietary rules and regulations for the students. They have to observe it for the next 90 days. Then, after 90 days, we didn't give any advice to them. Some of them were following the advices. Some of them were not following the advices. So, though there is no specific advice related to diet, was given on 180 to 360 days. The study was continued for, we collected the data again on 361st day, which is termed as a 1A. Again advice for change in diet pattern. Then we collected the data again and we did the statistical analysis and all those things. The inclusion criteria was like this. As I mentioned, the college going students were selected for this purpose. The exclusion criteria, below 18 and more than 24 years students were excluded, and if they have any major illnesses, they were excluded from the study. So the gender-wise distribution is here in this slide. The height and weight of the 307 participants, the diet preference, activity pattern. I just omitted the few slides because I was presenting yesterday and I found that there is a short duration, so I excluded all the slides from this presentation which are related with mainly related with the statistics, with the dosha, dhatu, mala and the psychological part also. So I am just directly coming to the discussion part. So dhatu formation is an uninterrupted continuous process. All type of food consumed a day or for few days will get adjusted, but if this procedure is going to be continued, there are certain changes related to the dosha, dhatu and mala. If the food is ingested in unfavorable circumstances with disturbed intellectual properties, then it is possible that it will only culminate not only in unhealthy dhatus but also unhealthy intellectual faculties also. So such a continuously happening events can give rise to the viprakrishta hetu, the distance etiological factor you can say, and can form the nucleus for chronic metabolic diseases of future. So this is a first cause in the student life that the lifestyle disorder starts from this particular age, from the age of 18 to 24. Because earlier, below 18 age, they are following the dietary pattern which their parents are giving. But when they start to go to the college or university level, they are changing their dietary habits. So absorption process is explained in Ayurveda, the Kshiradadi Nyaya, Kedarakulya Nyaya and Khalekapota Nyaya. So due to Ama Nirmiti, there is disturbance in this process of successive dhatu formation, because due to the Ama there is a blockage, you can say there is a Shroto Rodha. So that disturbs the dhatu formation process. Outside food always ends with Madhur Rasa as a dessert, and the food is begun with Katu, Amla and Lavana items as a starter. So this is not advocated in Ayurveda actually. So the conclusion is that the food habits play a major role in Medovaha Srotas. When the students were advised for change in diet pattern, they showed favorable changes. Food has a definite action on both body and mind. Food eaten in unfavorable circumstances has untoward effects, mainly in intellectual faculties. Almost all participants suffered from instability of mind and body, showed good signs of recovery and improvement after introduction of change in diet pattern. So I also gave some advices here that in learning phase, students should get nutritious food along with ideal circumstances. Education for examination of dosha, dhatu and especially mala daily, that should be given more importance in those days. So use of Agni Dipana and Amapachana measures. Proper food is the base of healthy mind and body. Education about Ayurvedic principles of Patyakara food this knowledge should be given to all the college going students. College authorities should periodically inspect the hostel mess for quality of food and mess atmosphere. Student of Ayurveda should become ambassador to advocate the importance of diet and nutrition according to Ayurveda. Thank you.
So Thank you, Dr. Professor Yeola. This was highlighting the importance of food habits and its circumstances.